both in refugee and host communities, have lots of issues to deal with on a daily to have a good sexual and reproductive health.
Under the South Sudanese culture, women are not allowed to be leaders, women were not allowed to have income, women did not have land rights. But through the empowerment that they are getting, they have come out steadily.
This project has turned around the lives of women and girls who came in as refugees. I have visited women and girls that have established different income generating activities. This project has also brought on board men who are actually now gender champions in the community.
UN Women's Program on Women's Empowerment Power, with support from the Austrian Development Agency, was launched to address these barriers in humanitarian settings in the Horn of Africa. Through Power, UN Women and partners have shown that removing gender-related barriers that prevent women, children, and adolescents from seeking services can improve their access and enjoyment of their right to sexual, reproductive, and maternal health, even in humanitarian settings.
We have power groups established in the host community. The same power groups are established in the settlement areas. So this alone is a key to ease up government projects or government programs that are being implemented in this district. Because if you have a strong community structure like this, where you can make it easy for mobilization. For instance, we're having mass vaccination in the different areas. Very few people turning up from the community. But we have power groups of young women who are empowered. Their lives have changed, and other people have noticed the change in their lives through these power groups who are sending the same information to the community for government programs that are rolling up.
Over the years, from the time UN Women started operating in Adjumani, we've had tremendous progress in issues to do with gender equality. Just before they joined, we had issues to do with cultural disease of the women. Men were not able to speak up, but through the support that we got through UN Women to our partners in the settlements, we've been able to empower women, and as I speak right now, we've achieved the gender parity of 54% for women leadership and 46% for men.
The population is quite huge, so this project is like a small drop in an ocean, but then it presents gains that actually can be scaled up. So to me, I take this as a challenge, but at the same time as an opportunity that actually when we further invest into this initiative, then we'll be in a position to deepen our impact, but also to bring on the critical mass of people. And when these women come together, then these power clubs can be used as platforms that actually can voice out the kind of inequalities that have been existing.
The UN Women intervention of partners has been zeroed down in a small place, that is Maji 1, 2, and 3. Then a little bit of Boroli. We have 19 settlements. At the level right now, I think at least we are above 60% of women who have been empowered in Maji. The women can now at least speak, they can express themselves, they can engage in livelihood activities freely, which wasn't the case then.
Beronu kaju ngutu bosonan angutu nango bata together morakinda ngutu lukata lagaloke morek yani nangaju ko gune karen naga dalu ngari do angutu nango bata do jadu morakinda da yala dingin naga kine todinesi ti pawe kine ngoje morakinda ngutu pirina gelenkene nalo ngone ko karen na but naga di joyesi yangi.
The overall goal is to examine and amend policies that leave women and girls behind and ensure they are aware of their rights and ways to demand them.
Most of the groups that we have dealt with, their issue is around money. It's a big barrier. We came to the field thinking that the barriers were around the cultural norms, but it's beyond norms that are cultural. It gets into norms that are contextual and structured. If you are in a community where you're not assured of a daily meal, there's no way you're going to tell me think about family planning, when probably sex work is the only thing that will give me food.
We have visited Maji camp and also Biribiri camp. Biribiri camp is the second biggest refugee camp worldwide and the biggest refugee camp that Uganda hosts. We have also seen women and men coming forward to declare their status. By losing that stigma, they can finally go and get access to health care, which they bitterly need. We also were able to meet a model man. He has now learned through this project to help his woman and his wife in the household.
Because my wife is vulnerable, I want to be exemplary in our community. I want to support her. Women are having a lot of responsibility. When you count from morning up to evening, men are doing maybe 2 or 3, just 3 responsibility. But for women, starting cleaning the house, washing the utensil, washing the children, cooking food, fetching firewood, cleaning the compound, a lot of work.
There's quite a lot that we need to do as regards sexual and reproductive health, and also empowering our women so that they remain relevant to support the young girls.
This project has been very short, and all leaders, all beneficiaries have actually echoed this and said, you cannot be seen to stop now. Let's work with you because we understand what you're doing and we see the value that it brings to the table.
UN Women and partners are working to end traditional harmful practices that impact women and girls by providing access to information on their rights and available services.